50% of the time that I see someone for an ADHD eval, I'm not giving them medication. I'm saying do behavioral techniques first, and let's give you a fair shot. And let me tell you exactly where to start from, what to research, dive in. You owe that to yourself to see if you can make a difference, because at the end of the day, I don't want you to be on medications if you don't have to.
Hello, everyone. Just like that, we are back talking about mental health, mental fitness, thinking what can we all do to just get that going a little better in our everyday lives. ADHD, attention deficit hyperactivity disorder, is a huge and popular issue in mental health and psychiatry. And I thought we should all talk about it because focus, and with focus, I'm also going to say creativity, impulsivity, sleep hygiene, organization, those are all things that are near and dear to all of our hearts. Whatever age you are listening, you're caring about that aspect of monitoring your mind, taking care of it. So we have got the wonderful Dr. Sasha Hamdani, who is a fellow board-certified psychiatrist, and she's an ADHD clinical expert. If you have been on social media, you have probably seen her because she is a very, very popular and wonderful creator. She's been a wonderful psychiatrist for the field. She is an best-selling author. She's an entrepreneur and a mental health advocate. She's worked closely with the White House and with the Surgeon General's team to speak out about mental health awareness. She's been recognized by Harvard University as a public health leader, and her social media profiles are just great. She's got all kinds of evidence-backed information that's really, really engaging about ADHD and just about mental health in general. And what I particularly like, Sasha, is your just wonderful ability to speak both, as an expert, as a clinician, as somebody who struggles with focus. Her book, Self-Care for People with ADHD, we've mentioned in our newsletter, I absolutely adore because along with seeking out professional help, getting a diagnosis, maybe getting medications, getting coaching around ADHD, knowing those aspects of self-care that really matter and make a difference from an expert like Sasha is great. That came out just last year, 2023, by Simon & Schuster. And then she also has a comprehensive ADHD management app called Focus Genie that came out last fall. Dr. Sasha Hamdani, welcome so much to the podcast.
Thank you so much. Thank you so much. I'm happy to be here.
Well, first, just orient us a little bit. Tell everybody where are we finding you and how are you doing? What's going on in your life?
Yeah, you're finding me in the basement of my house. I am in Kansas City right now, which is where I practice. And today is a Wednesday, so it's my day off from seeing patients. So it's a good day.
You're also getting ready to give your TED Talk, I heard. You got a little preview for us?
Basically, the gist of it is it's talking about how not a lot of people know about the default mode network, which is that underlying neural structures of when your brain is at active rest. So when you're daydreaming and when you're not doing anything in particular. So it's how to utilize that time, so daydreaming and being mindless, in order to enhance your focus.
Of harnessing the power of our default mode network. That's a network that's really come, I think, more into popular consciousness, especially a lot of times how the psychedelics work gets described in the context of default mode network, kind of the resting background state of our brain and this kind of benign disruption of that being helpful. I love that you're focusing on, hey, let's harness this and make it helpful.
Yeah, it's a cool area.
I want to get into default mode network, but let's just back up 1 second so everybody's on the same page with an expert like you. Sasha Hamdani, how do you think about what is ADHD?
So ADHD is a neurodevelopmental condition that impacts pretty much every area of functioning. So it's traditionally categorized by inattention, hyperactivity, and or impulsivity. To be totally honest with you, I think our modern day scope of ADHD is a little bit limited because I think once you get into it, you see a lot of emotional things going on in the background. You see a lot of dysregulation happening, not just with attention, but absolutely everything else: sleep, appetite, energy, mood.
It's a huge point also, that a little more, I'd call it, holistic view of, if you're having problems with impulsivity and sitting still, that doesn't just get you in trouble with the teacher. That gets you in trouble when you're dating, or maybe in trouble isn't or causes challenges for you in your work life, in a meeting.
It can get you in trouble.
It's okay. We can say it that
Yeah.
way. So, um, and I think that's a really, because so often it's just, hey, this is focus in schoolwork. And that's really
Yeah.
not fair to patients and individuals who are struggling with these conditions, because that's not the only place they see it.
Yeah. True.
Keep going though. Tell us more about it. What are the aspects? And especially when people are listening, so many people get this question like, do I have this? Does my child has this? What are some of the, kind of signs and indicators that this is something going on in our lives?
Yeah. So I think that, again, this is going back to, I think that our traditional metric of diagnosis, we rely on that DSM to give us our criteria for diagnosis. And I think that it is kind of crappy and kind of narrow, because I don't think it encapsulates everything. But I don't think that the way that you look at the parameters of what criteria you qualify for is they break it down into inattentive, hyperactive, and then combined, which is a combination of both. So inattentive is kind of this spacey, inattentive presentation. So difficulty with losing things, difficulty paying attention to when people are talking, people trying to redirect your attention because they don't think you're listening to them. Difficulty with organization, the stuff that you think about. Just, I got called a space cadet a lot when I was growing up, and that's what you think about, the daydreamer. And then the hyperactive is more like physically hyperactive and impulsive, whether that's verbal or physical. So you have a lot of shifting around in your seat, difficulty staying in one spot, fidgeting. And then you also have verbal impulsivity. You're interrupting people. You're hyperverbal. You're talking all the time. You're maybe saying inappropriate things. So those are, and then combined is obviously the combination of the two.
Thank you, Sasha. That gives a nice kind of overview, and I think kind of tipping your head a little bit towards, hey, these are the criteria. They're narrow, and in some ways for a reason. It's a research. DSM's a research tool, so to allow folks to actually decide, okay, who goes in a study or not. And in some ways, that's really at the core of its design. But there are other ways that people are influenced or see these conditions in their life that maybe doesn't get totally captured by those criteria. I suspect a lot of folks listening resonated with some of what you're saying. Staying organized is tough. A lot of us, especially, you're spending a lot of time on Zoom at work, or if your work didn't completely recover from the pandemic and you're still in that kind of hybrid spot, a lot of time sitting in the Zoom room. I'm not one of those folks who's gotten the walking desk yet. How do we know the difference between, we're struggling with like modern life, there's a lot to keep track of, and maybe I have ADHD.
I think humans in general are going to struggle with intermittent difficulty focusing. We're just in a weird spot in the universe and in the world right now where our civilization is built to just be really distracting. So I think that that's something that everybody can probably relate to. I think the difference with ADHD is it's very pervasive and you feel like there's a lack of control to some degree. So sometimes, even if things are distracting, people can kind of restructure, reorganize, and pull it together and get through that moment. And I think with ADHD, just because of neurobiological differences, it's very difficult to do so, if not impossible.
I think people are always curious about those neurobiological differences, brain differences, right? Where a lot of folks get frustrated with ADHD, both in boys, but I also think there's a different presentation in young women. Can you tell us a little bit more, kind of about that aspect of it?
How males and females are different?
A little bit about how males and females are different.
Yeah. So typically, and when I'm saying females, I'm talking about assigned female at birth. I think that there is a huge, for better or worse. No, actually, I take that back. For worse, there was this huge gap in diagnosis and in awareness because people just incorrectly assumed that ADHD only impacted young males. And so they were looking for young, hyper boys. And so women generationally were skipped because they don't fall into that category. The reason for that is, there's a lot of them. One, I mean, it goes back to just maybe like people were adhering to this very narrow scope and understanding of ADHD. Two, females present more as inattentive. So those symptoms might be skipped because they're not disrupting the class. They're disrupting themselves, but nobody else. And they just get passed from grade to grade to grade. And they're not really an issue for anybody else besides themselves.
And a lot of times folks who are bright and have ADHD compensate so much that their grades are still okay. I know there needs to be interference with academic functioning for formal diagnosis, but some patients I've seen, like, no, I always got straight A's. It just took me twice as long,
twice as distressing. Just it's so much harder. I think women also got skipped because they're more likely to get misdiagnosed with something else. So they're always going to be, you're hormonal.
What are the most common misdiagnoses where people have ADHD, but it gets missed and diagnosed as something else?
I mean, there are a lot of them. You get a lot of crossover with incorrect diagnosis of anxiety, and there might be ADHD can make you anxious. You get a lot of misdiagnosis of depression. You get a lot of misdiagnosis of bipolar. Even you get a lot of misdiagnosis of personality disorder with that rapidly shifting emotional state, like we don't even use access to, but like borderline stuff. You can also there's a lot of medical stuff that can look like ADHD. If your thyroid isn't improperly managed, you have to worry about things like that. If you're anemic to some degree, you have to worry about things like that. If you're dealing with multiple vitamin deficiencies. So there's so many different things that you have to be conscious of. And that's part of the reason why getting a good, solid, comprehensive evaluation by someone who I'm biased because I think that people, if they have access to it, should try to go to a psychiatrist because it's kind of the best of all worlds because you have that input from, they've gone to medical school so they can rule out medical etiology. They've gone through residency so they know kind of more about that psychosocial dynamics involved. And then they've been well versed in that realm of psychiatry in general so they can do this in-depth ruling out of other things. That's my rant.
Well, I don't hear it as a rant. I'm sure everybody listening is really curious. I realized some of that question about differences wasn't also just male and female. I guess what I was also curious about is there's a description of brain differences in a way that there never has been before. And I was wondering if you could share a little bit of how you kind of view and see brain and brain circuitry working and not working or struggling in patients with ADHD.
So there's a lot of new stuff that's coming out. I mean, there's talking about the size and the width of your prefrontal cortex. They're talking about different areas within the reticular activating system and different areas within that brain that are wired differently, structured differently. They're sitting a little bit differently within that brain space. I would say that there are so many different neural variants. And I think that it's so hard to get an accurate read and to image properly, like outside of postmortem studies, right? You don't want to wait till you're dead to get this information in. I still feel like we have a lot of room to go in order to make these definitive statements about brain architecture and structure. There's for sure trends, but I think when we start moving into people are starting to lean on more things like fMRI imaging, specifically to help diagnose ADHD, or what's worse is when you see people who are saying fMRI is going to help you as you're progressing through your treatment to show that it's treating or cleaning or clearing. That I hate that. I hate it.
Tell us about this, Sasha. I mean, I think there's so much now with neuroimaging, with preventative scans. There's certainly been a controversial movement within some corners of psychiatry diagnosing ADHD with SPECT scans. I mean, and I'm sure lots of people are saying, hey, we can scan you and show that this is getting better. What's the real story with that?
I think they make pretty pictures. I think brains are too neurodiverse. There's so much change that your brain is just not static. I mean, your brain is constantly changing and neuromodulating to the environment and to all these other factors that are going on. It changes with medication. It changes with nutritional status. You know that it changes with so many different factors. So I think that looking at these like transient images of glucose uptake or, other things like that, I don't really know what you're getting out of that.
I'm sure everybody listening, it's a great perspective, right? Imagine just most recent last couple of weeks. Like, what's the worst mood you've been in? Try to think back, really like, bad mood. And like, would your brain look differently on an imaging scan? Maybe. But if it did, what would that sort of tell you or inform you? And or how would that shift what you probably in some ways know around some of the mental fitness things that you can do to help you with that mood? So, yeah, imaging in terms of diagnostics and psychiatry is really not something that it sounds like you feel you need to effectively manage and treat ADHD.
Well, no, I don't feel like we need that. The other thing is, I don't feel like the reason I feel strongly about it also is that, I mean, it's not been well founded that it shows like it can track progression adequately and that it actually shows you anything that really changes a treatment trajectory. But the other thing is like it is so ineffective cost wise, and you're just doing something that is theoretical and spending so much money. And I feel like the reason I have beef with that is because it's exploiting a vulnerable population. So you're telling them like, this is the end all be all. This is really going to help you. This is the gold standard. This is what everyone should be doing. And really, is it proving anything? No.
Well, it also sets up a bit of a horrible dynamic for folks who don't have the resources to engage
Yeah.
in what sounds like unnecessary imaging. You get the sense that maybe you're not getting the treatment that you should be because you're not getting this work done or not getting that imaging scan. When actually, in fact, you don't need that for effective treatment and to achieve remission.
Yeah.
Now, one of the challenges, as you mentioned, is misdiagnosis. And because things like depression, for example, have cognitive impairment, really common symptom, people just don't, a lot of times, even when folks recover in sort of mood or less cheerfulness, better mood, still there's a cognitive, like a sluggishness, not feeling quite as bright or as fast or as sharp. Is there a way that in your practice you differentiate between that and something that's more of a ADHD in origin?
Kind of depends because there's a lot of crossover that can happen. I think that it kind of, in my opinion, you have to kind of go and weigh based on the symptoms what is the most likely culprit here, and then you treat. And if it doesn't get better, you course correct and you go to the other one, which is not necessarily the best way to go about it, but I don't really know any other way to.
That I appreciate you saying that, Sasha, because psychiatry really gets criticized. But you and I both being practicing psychiatrists and prescribing, there is a little bit of truth to that, and I think good clinicians are honest about that. We are making the best decision. It's not a guess; it's a decision about what medicine is going to be most effective for you based on what you've shared. We're not always right. And when we're wrong, good, or when there's something that isn't optimal, maybe you get some symptom relief, but you're still having side effects. Or I find sometimes with some of the stimulants, like I just saw a patient today who's really doing a much better job managing her ADHD and on top of a number of medical conditions, been much more consistent. But I was asking her about like a dysphoria or a low mood crash that happens. Some of my patients, their stimulant wears off. And like 7 p.m. at night, it's just they get hit with a very sad, sometimes desperate, catastrophic feeling. It can be very frightening to patients. On another stimulant, they don't. And so there is that, in some ways, nuance of prescribing that gets missed. That I hate it when it gets portrayed as like, oh, it's just trial and error. And it's like, I don't know what are there aspects of life that aren't something of that? Like I haven't really bumped into too many that don't involve some aspect of the way of trial and error is, I think, talking about that we're learning what's best.
Well, it's hard because in psychiatry, it's not like, it's not ortho. You're not going to get an x-ray and see how a bone is healing. It's not internal medicine where you're like, okay, let me look at their white count, see if this infection is clearing. Like you don't have those metrics. We are basing our opinion on how what the patient is relating to us. And so sometimes it's really difficult because you're trying to amalgamate a story and a narrative so that you can prescribe appropriately. But the patient in front of you is going through so much that they can't even describe their own internal environment. So it's just a very incomplete process that requires a lot of, it just leaves a lot of window for potentially making, for taking a while to get to where you need to get to. It can be really frustrating for sure.
Yeah, and I think acknowledging that frustration and being part of a process and an active collaboration with our patients is really how everyone gets the most mileage and gets the best results. I want to get to lifestyle tips, particularly what you eat and how you think about your self-care, especially as that's the focus of your great book. And folks listening, make sure and check out Sasha's book, and just filled with really great advice. But before we get to that, I want to talk about stimulants, because stimulants are such a controversial topic. They are the cornerstone of treatment for attentional problems. A lot of times that scenario I asked Sasha about, hey, someone's got depression and they've got some cognitive challenges. A lot of those who are of us prescribers will add on a dopaminergic agent, an agent that affects dopamine, like a Wellbutrin, a bupropion, an antidepressant that affects dopamine, or more often than not in ADHD, a stimulant, whether that's methylphenidate, Ritalin, or one of the Adderall or methamphetamine formulations. Tell us your thoughts on stimulants, how you use them, what we should know about them. It's such a controversial topic.
I mean, but should it be controversial? It's a line of treatment, and I think that some people stimulants stimulants, Adderall, Ritalin, Vyvanse derivatives. You have that Adderall family and that Ritalin family. They're just treatments for ADHD, and for some people they are extremely effective, and for some people they are more side effects than what they're worth. I think part of why it gets a bad name is twofold. Number one, it's improper prescribing practices, and number two is improper use practices, right?
Tell us about both of those. And before that, Sasha, I love Sasha just demonstrated something that's really important that everyone sees and I hope heard. The way I frame that question creates stigma. Oh, it's so controversial, Sasha. Stimulants. Oh, tell us about stimulants are the first line treatment for attention deficit disorder, and framing that psychiatrists are, I don't know, somehow inappropriately prescribing them, or that they're controversial because, I think some influencers have very strong opinions about them. That's just contributing to stigma. What people should hear is they're a treatment. And Sasha, why don't you share with us some of the facts about how this treatment really works? You said two reasons for our biases, that people don't maybe prescribe them responsibly and that people don't take them responsibly. Can you tell us about those?
So basically what those medications are doing is they're just releasing norepinephrine into your brain. And so there are other ways that you can do that with other agents. But the reason why stimulants are so coveted within that psychiatry realm is that they work so quickly. So depending on the kind you have, it could be like 10 minutes into taking it. It could be an hour into taking it, and you start noticing a difference neurologically in your brain functioning. That's really incredible in terms of a psychiatric medication, especially for people who are having difficulty with executive functioning and processing and like getting through their day. This is something that can level the playing field. It's not that they feel high. They don't feel like they're on a limitless drug. It's that they feel normal. This is what I should have felt like.
Yeah, and that's one of the questions I've heard ADHD experts talk about, is really differentiating. Are you feeling great? You have like a sense of euphoria and confidence, which isn't really what you're after.
We're not going for that.
Or are you feeling accomplished and you're noticing, I sat down at my desk and I banged out an hour of work and there's work product. Or I sat down, I hate, going through old emails and responding. But I got it all done this morning. It was just cranked it out. That's very different than I feel amazing, I'm talking fast, the kind of more euphoric side effects of the stimulants that can happen. Sasha, you said norepinephrine. When we say stimulants, everybody thinks dopamine. Help us understand that difference.
No.
No? Come
Well,
on.
because I don't have a really good response. Depending on what is kind of going on within the brain, norepinephrine and dopamine, they work closely together, and so depending on how, like, especially if you're doing a long acting versus a short acting versus, like, we're talking specifically about stimulants, but with non-stimulants, each of them kind of has a different shift on how it opens up and exposes your brain to that. And also, the other thing that comes into play is how you are built anatomically, how you're built, and what you're capable of uptake and reuptake. There are people that are genetic fast metabolizers, genetic slow metabolizers. So both of those are interrelated, and it's more complicated than I can explain eloquently.
I appreciate the honest answer. I think so often people are like, the dopamine goes up and this goes up and this goes down,
Uh-huh.
and knowing or staying more in the notion that dopamine and norepinephrine are really involved in drive, focus, learning, motivation, and these medications affect both of them.
And they're so intercorrelated, like it touches absolutely everything else in the brain. So if you're saying that it only impacts one kind of thing, you're not encapsulating all of those other things it's indirectly touching. So it's too complicated to explain. I can't do it.
Well, I also think you're speaking about how there's this temptation to get reductionistic as we explain mental brain health stuff in psychiatry. Like serotonin makes you happy. It's like, well, actually, serotonin also can impair cognition or improve it, or make people very creative, depending on all kinds of different factors. It's not as simple as one molecule leads to one set of feelings, and I think it's just something that we always have to go back to, because I think so many folks, like Dr. Hamdani and myself, who are wanting to get this into the conversation, and then phrases like chemical imbalance come out, which is a nice way of trying to reduce stigma. This is about chemicals in our brain. This isn't that we're bad people or we can't focus, but at the same time, it's a little bit of a what we call kind of concrete. It doesn't explain all the kind of magic and nuance, and it in some ways makes it sound like we know a little bit more than we do.
Yeah.
Can we get just into if I'm somebody who thinks I have ADHD, I go and I see an expert. You're noting something really important. One of the things that I'll know pretty quickly is, unlike an antidepressant, which can take a month, a stimulant medication, I might feel something within a couple of minutes, an hour, that indicates, oh boy, something's really kind of working better for me.
Mm-hmm. But, I also don't think that that's necessarily diagnostic, right?
That's the hard part of this, right? Is almost everybody who takes a stimulant is going to have increased goal-directed behavior. I often share this with patients of, it's if someone's really disorganized and really struggling and has classic signs, okay, but a lot of folks who, maybe are not fully meeting criteria for ADHD, but are struggling with focus, there's not a clear medical reason. We see this a lot in the depression treatment, right, where a stimulant gets added on to an antidepressant, and people have more goal-directed behavior. They're more productive. Sometimes even they sleep better, sometimes worse, but sometimes there's more uh, less appetite and more control over eating behavior, which sometimes can have really strong impacts on how patients are feeling and focusing. So it's quite nuanced. Are there kind of regimens that you end up with? I'm going to say both medicine, both stimulant and non-stimulant, that kind of emerge to you as what you feel, is kind of a good tried and true step one, or is the medications really kind of quite variable? Like when I come and see you, it's really unclear what I'm going to walk out with until the end of the session.
Yeah, it totally depends on the person. It totally depends on the person. And I would say 50% of the time that I see someone for an ADHD eval, I'm not giving them medication.
Really?
I'm saying do behavioral techniques first. And let's give you a fair shot. And let me tell you exactly like where to start from, what to research, what to dive in. You owe that to yourself to see if you can make a difference, because at the end of the day, I don't want you to be on medications if you don't have to. And then if you can't do that, then let's do a medication while you're doing the behavioral techniques, but you know what to do at that point.
Tell us about the behavioral techniques. Where does someone listening start to try and harness more focus?
I think it stems from, number one, understanding how your brain works. And I think the first step is tracking your own patterns. So, but like, what am I doing in terms of sleep? What am I doing in terms of exercise? What am I doing in terms of diet? What am I doing in terms of water intake? Where is my, for women, I tell them, like, look and track your cycle. Do you feel like there's an intense correlation with those? Like, do you feel like those periods where you can't get anything done correlate with that premenstrual period? Like, look and track and that's part of the reason why during COVID, I worked so hard on this app. It's because I wanted to do a focus tracker so that I can visually see kind of and it's only by making that and creating that I was able to be like, okay, there is such distinct patterns. And so I think that's the first step.
It's one of those really, I would say, fun, new, exciting ways tech is helping us, that we can track a lot of data. I think it most with the sleep. I have one of these sleep rings, and we had team meeting today, and I had a really early 5 a.m. patient, and Andrew said,
5 a.m.
How often, how much did you sleep? And he'd been the reason I got my Aura ring years ago. I have like 4 years of sleep data. And I said, oh, well, let's find out. Just like, let's be honest. It's not, not much. It's like, no, I had 5.5 hours of really actually quite high quality sleep for the minimum amount of time. I was pretty impressed with and so, as you're saying, like, being able to track focus, being able to use an app and get a sense, okay, yeah, there's a pattern. I'm mid-cycle, my focus goes, my mood goes, or no, it's more of a, kind of feels like a bit of a PMDD, but it's more focus. Being premenstrual dysphoric disorder, where there can be really extreme symptoms prior to menses. So I think that's really helpful. So one, kind of tracking, and are we tracking like when we really feel focused, when we feel overwhelmed? Like what kind of things are we thinking about? Mood? Like what matters the most, do you think?
I think looking at kind of focus, and it doesn't have to be like 1 out of 10. It could be like, today was good focus. Today was average focus. Today was bad focus. Like, it can be that rudimentary. Looking at focus, looking at impulsivity. You might look at like fidgeting, like how physically kind of restless you were. So things like that, I think, are relatively easy to track.
How do we track impulsivity?
Oh my God, credit card charges, man.
What's that?
Go to Amazon.
That's
what I saw. I mean, I had a $600 bump during my premenstrual period.
You could just see you just kept spending like an extra few $100s.
I just sit on my phone in the evenings, like during that time, because I just am like, I'm over it. And I just buy stuff on Amazon. I mean, I just need to delete the app off my phone.
But you just it's a way. So impulsive purchases are one way. I guess when people maybe are like dating or kind of maybe involved in decisions, people are out, maybe, I don't know, drinking. Do you see those kind of things? People get kind of more impulsive around those behaviors?
Yeah, you absolutely can. You can see all of those things. It can also happen with, we see a huge correlation between that and food impulsivity. So people are just making bad choices. And I say bad choices in terms of like choices that it's out of ease, it's out of convenience. They might have been staying on track in terms of a regimented schedule that's better for their own personal health. And then, that 4 days happen and it's all shot to hell.
Well, that's really interesting. This idea that keeping a kind of regimented schedule sometimes requires people, you're a busy student, to, I don't know, eat some processed foods, eat some ramen, go to the cafeteria, because you've got to stay on a regimented study schedule. But then that also can really get out of control, and people have very dysregulated eating behavior. What do you recommend, behaviorally, as you think about nutrition in people with ADHD? What do you look for as first steps for people who are really, struggling with that modern American diet?
I think, again, it comes back to tracking it first. So figure out, what are you doing and for a lot of my patients, including myself, I felt like it wasn't so much what I was eating at first. It became about that later, but it became how I was eating. So I would go long periods of, like, I'd get busy at work and I would just not eat for prolonged periods of time. And then by the time I got back from work, I was so depleted that I would just eat whatever was there. And it like, and then I would feel terrible. Like it wasn't suiting my body. I would feel very slowed down, sluggish. And it would start to impact my mood because I was just like, oh, I just feel, how is it every night I feel terrible? And it's like, oh yeah, I had 6 bowls of cereal and nothing else. So it just, it's stuff like that, knowing your patterns. And then once you kind of figure out like, this is when I feel for me personally, I feel hungry every 3 hours. So I don't eat that like standard, like typical 3 meals a day. I'm eating like 6 meals a day. I eat like tiny meals throughout the day.
That's actually one of the challenges with the stimulants is the appetite suppression. And that a lot of times those natural, normal hunger cues for lunch, people are grinding on work, they're very focused, and they just kind of skip meals. Is there a way that you account for that? Is that part of where eating regularly is something you recommend to patients as well?
I always tell people that it's really important, especially if you are taking a medication that's going to suppress that, setting alarms and forcing yourself to eat during those times. And it doesn't have to be, the thought about forcing yourself to eat is so disgusting. But like it could be something like just, when you are at your desk and you're knowing that the stimulant is active, having those visual cues, like keeping protein bars on your desk, keeping a shake on your desk, things like that. Those can be helpful because you might not even feel hungry at that time.
Sasha, I realize we're talking about ADHD and talking about kind of some of what you do, and it feels like we haven't been respectful. That one of the things about you that I find really unique is you're very open about your own ADHD. And so as you're talking about medications and lifestyle and stimulants, these are things that you've tried. It's not just that you give them to patients. Could you tell us about what that's been like for you?
Yeah. So when I was diagnosed with ADHD in 4th grade, and I was unaware at that time. I was very disruptive, and the teachers talked to my parents. My parents got me evaluated. I was started on medication. But I think it was just stigmatized at that point that they didn't know how to break that to me. So I just took my vitamin every day, did awesome. And then I got
vitamin R, and I was like, and you didn't have a sense. Did you have, I don't know, like side effects, or did you have an experience of your brain really starting to be organized in some way that you related to the pill?
No. I mean, I guess I just didn't think about it. I just took it with my Centrum and I would just eat it in the morning, and I did really well. And I think I only started to like my dose never changed. And then in 10th and 11th grade, I was like, whew, I just like, I can't keep it together in my afternoon classes. And none of us really pieced it together. We just thought that I was becoming more of a teenager and I just had different interests, but when really my focus would just like kind of wear off, and I couldn't muster it.
It's such a great point also for everyone listening, as maybe you're a parent and you have a child who you're thinking about or has some challenges of how kids grow, and a dose of 10 milligrams of Adderall, it's different in a child that weighs 80 pounds than a child that weighs 120 pounds. Also, I think one of the other notable things about the stimulants is some of them need to be eaten with food. Some that's not as important. Some need to be dosed twice a day. Some are only dosed once a day. As Dr. Hamdani noticed, some people metabolize them faster than others. So I have given patients, said, "Hey, this is an all day formulation. It's going to last all day. We're worried about your sleep," and they say, "No, it wore off at lunch."
Yeah. So I got to a point where I did well enough that I got into med school. So that was the first time I had been away from home. So I went in at 18, started those classes, immediately was like, this sucks. I know I can't do this. And my parents were like, why are you so bad at school now? You were awesome a second ago. And I was like, I really don't know. And they were like, are you taking your vitamin? And I was like, I truly don't even know where my vitamin is. Like, I don't know where it is. And so then they were like, okay, well, you have ADHD. And then it became like I don't. Like, there's no way. And I just rebelled against it. And I did so badly that I almost I was on probation that first year because they were like, there's no way you're going to make it through. And my dad did something that I think, like a brilliant moment in parenting. He was like, all right, fine. Like, you don't even have to worry about school. Just come home. And for a week, I didn't know if I was going back to school. I didn't know what I was doing. And all we did was we sat in a library and studied ADHD and just like, does this look like you? Do you believe in this? What is happening in your brain? And this was like before there was so much available on the internet. So we were like reading books and really getting immersed into it.
What a cool dad, and what a nice parenting moment. I think, so many of us, when we're thinking about our kids and their mental health, we like the sound of that, like being in the thoughtful, let's all learn about it together stance. But I think a lot of times, even if you're very sophisticated about mental health, we just get really anxious, and we want to be really helpful, and we want to fix it as a parent. And with mental health stuff, that's much better, I think. And I wonder if everyone listening agrees, that to be more of a partner and a supporter. And wow, this is like complicated. Let's learn about it. How's that sound to you, Sasha? I mean, that sounds like a really nice time with your dad.
It was like such a blessed time. And like that is what rerouted my entire medical career, because at that point I was like, okay, what he gave me, that gift of like curiosity and like in a very non-judgmental way, looking at my brain and functionality, it's what made me interested in kind of like, I want to help other people do this as well. And so that's kind of what changed that trajectory and kind of led me closer to getting into that spot. And so the rest of med school was, I truly was climbing out of that hole. But then it became, okay, let's look at treatments. And, a lot of the treatments I wasn't eating. And so my weight would drop significantly, or I wasn't sleeping. And I'm like, ooh, it's day 2 of not sleeping. This isn't sustainable. So I wasn't great at medications, and then finally landed on something that would get me kind of through for a little bit. And then, I got into psychiatry residency. I moved to Phoenix, and it was so hot. It was so hot that I was just perpetually dehydrated. And so stimulants were even harder for me to take. And I was like passing out because I was just dehydrated. My heart rate would go up. And so I had to just like kind of figure out like, well, how am I going to do this without? So I had to stop medication and kind of look to other kind of resources. And that's when I think they did a really good job kind of surrounding me and building me up and building up these truly that program built me from the ground level and gave me that kind of behavioral reset I needed so that I could go forward.
Let's give a shout out. That's the University of Arizona Psychiatry Residency, crafting another psychiatrist. I love hearing about that because I think so many of us who are in mental health, whether you're a psychologist or psychiatrist or social worker or a master's level therapist, there are those experiences where we get formed, as you say, get taken care of. They see us for who we are, and help turn us into a psychiatrist. So you're now in residency. You've made it through med school with medications helping your ADHD. You're getting dehydrated because it's like 100 plus degrees all the time. Being a new psychiatrist is really challenging mentally, emotionally. It's the only field in medicine where you need to sit down and focus for 45 minutes straight. There's no break. And you can't get any of it wrong because patients know right away if you're not paying attention, if you're nodding off, if you didn't remember something. How do you navigate that? That must have been terrifying.
Again, I think that program really made it conducive for me. So I had an attending whose name was Dr. Friedman, and he's amazing. And I think he's still there.
I'm sure he is. Shout out to Dr. Friedman. I love hearing about these psychiatrists.
Dennis Friedman, just amazing. And all of my attendings there, so they just cultivated that. And when I was, there was a time where things were really difficult and overwhelming, and they would do things like, name all the things you ate today. I was like, a Pop-Tart. And they're like, no, try again. And so I was like, I haven't eaten anything but a Pop-Tart. And they were like, okay, well, instead of seeing this patient right now, we're gonna give this to another person. Go and eat properly, and then we'll try this again. So, I mean, they just they gave me such a healthy space to grow and learn my own patterns and like behaviorally modify. So it was terrifying, but I had such good support that it didn't feel as oppressive.
It also sounds like it wasn't punitive.
Mm-mm.
It wasn't like, wow, there's like a real problem, Dr. Hamdani. You're really not.
Yeah, I thought it would be, but they weren't. They were so loving. It was a small class too, so they spent a lot of time just kind of making all of us grow. And I think as a result, the people who graduated from that class are wonderful.
I think that's true of a lot of folks in our field. It's a really, I remember I didn't go to the American Psychiatric Association, our big annual conference. Sorry, I was getting inside baseball about psychiatry, but I hope people are curious. But I remember one of the first times I went after being away for a while, maybe a decade ago, and I got like this overwhelmed, misty. I was like I'd taken psychedelics. I was like, I felt so connected. I had this thought, like everybody in this room loves doing a mental status exam, and and like this nerdy kind of caring about people and behavior and the inner workings of our dynamics. Like, boy, this is everybody here thinks about that too. And the thing that's very special about psychiatry in the fields of medicine is we're certainly one of the earliest fields to really have significant diversity and significant kind of more gender, I would say, like equality in our mix. And so it's really just it's like a wonderful population of clinicians. So I also love how this is a story of how accommodation works. If you go to a residency that's punitive, that punishes you, that's competitive, that says, too bad, you can't take your meds or whatever, we don't get Sasha Hamdani, who's giving us Focus Genie and a book on ADHD. And I think you're the only psychiatrist that's ever had your picture up on the New York Times, like those billboards, or not, what, Times Square billboard. Well, I mean, there's a couple, like Greg Scott Brown, our buddy. I think he's the only psychiatrist who's ever had a full page picture of himself in Men's Health magazine, which I just think is awesome, talking about his work and struggle with depression. And so when I saw you go up in Times Square, it just totally made my day, because it's just, it shows where psychiatry has come, that we're not scared of being out in public. And I don't know, I'm sure that's a whole lot, having your image displayed to millions of people like that. But man, it's awesome for the field. It's often for women in medicine, and it's just awesome to show what happens when people take care of their ADHD well. So,
you're a good egg.
Dr. Cheers Ramsey. To you, Dr. Hamdani. Well, I do just have a couple quick questions, because we've gotten here to the end, and I haven't asked you about your mental fitness routine, and especially when it's on, when Dr. Hamdani is dialed in. You are the Focus Genie. Right? You pop out of the Focus Genie bottle and you're like, welcome, Dr. Hamdani is here. What does it take for you to really consistently be in that space?
So unfortunately for me, I'm not super athletic. So that is a big problem for me, because moving my body and being physical is one of the things that really, really, really helps my brain. And I think it's just that funneling of, getting that blood flow. And I feel like once I started like distinguishing, like, oh, this consistency isn't going to make me hotter. It's just going to make my brain is going to work better. I think I became more consistent. And so finding something that really worked for my body. And so I think that combination of yoga and Pilates, the reason it's unfortunate for me is it's so expensive. So I have been just trying to Frankenstein my way into it at home. But I think that, number one, moving my body has become very, very important in terms of my routine, in terms of regulating my mood, in terms of regulating my sleep and my appetite. Like if I exercise, all of those things naturally kind of fall into play. Whereas if I don't, I don't have the same kind of hunger cues. I don't have the same kind of sleep cues. I don't have the same kind of, I just feel like it's hard. I'm more reactive, very much so more reactive. So I think that is one thing. Number two, I think prioritizing the time that I have doing things I really enjoy. Because I think with ADHD, you get so scattered. And so you always kind of feel like you're running behind. And because of that, it's very easy to lose time of things that you are prioritizing as things that are really important to you. So I really have enjoyed using my moments and being very mindful about the time that I spend with my family at home.
That's
That
such a
makes me
great,
mentally fit.
almost diagnostic tip for everyone. Or if you are always running your list, if you're always catching up, like it could be that you're just too busy and you're overwhelmed, and really the lack of focus and the lack of feeling progress, and especially the lack of having time to do things that you enjoy. Not that you don't enjoy your work, but just, those really fun, leisurely hobby, family, whatever it is. That one really resonates with me, Sasha, because I can definitely get in that mode of it's 6 o'clock and all I'm doing is running my list and thinking through my patients and what do I have to do? What didn't I send in? Um, uh, it's like a vigilant way of compensating. And can you tell us a little bit about the consistency in terms of, okay, we know to exercise, that's hard for you too. How do you make it regular? And how do you kind of keep that a personal time in your life?
I make it, I only became consistent with it once I recognized that there were immediate brain benefits. Because like before, I'd become very inconsistent because I was working out towards like, I'm going to look better. I'm going to keep this body type or attain this body type or like work out to look a specific way. And I think that I have discarded that as that's no longer my goal. And I think having kids just kind of forced me to discard that because your body changes, your brain changes, all of you changes. And now I've tied my exercise with my mental health, and it's so much easier for me to maintain that because I see immediate benefits. I feel better immediately.
Thank you for that, Sasha. That's I also like that idea that exercise was hard for you when you were focused on something that I don't know, like we all resonate with, right? Staying in shape, looking good, feeling strong, etc. But that wasn't really doing it for you as much as thinking about the feeling state that it gave you and the mental state that it gives you, and setting that as a goal that maybe felt like more appropriate, but also I don't know. The other goals, it feels a little like I don't mind my vanity, right? But I got to have a little bit more than that to really motivate me, because otherwise, it's. Uh, I got a question for me. This is about being a psychiatrist. This is a question about our kids, everybody, and I think it's something that I want to hear if you'd share a little bit about how you approach being a mom and having ADHD and thinking about your kids. My family's more on kind of the mood disorder spectrum, but sometimes I'm not very impressed with how I maybe handle some of that or think about some of what's going on with my kids in terms of their mood or focus. I find myself in some ways even a little like anxious, and I'm wondering how you approach it as you think about your kids and about their education, and maybe I don't mean you to disclose anything about your kids, but maybe more hypothetically, if you see some challenge or not, like how do you handle that as a physician, psychiatrist, mom, and patient with lived experience?
I think being a parent is universally difficult. I think it's so rewarding, but it's so taxing because you're never really off. So you're constantly thinking and planning and trying to figure out next steps and ensure safety and ensure that they have a good, productive, happy life. I think learning how to balance that is just like logistically. I think a lot of us know the pieces that we need to get there. Like we know what needs to happen in terms of their life, and like this is how often a kid needs to eat. This is what time they need to sleep. This is what they need to do in terms of schooling. I think that what has been, and I learned this from my own family. I think the best parenting, like if I go back and I think back on how I was raised, is when I was treated with like kind of curiosity and kind of almost like a psychodynamic approach right? My parents let me kind of lead, and they would approach how they would address my needs based on how I was expressing them, how I was vocalizing it. So I think that was really nice because it opened up a lot of dialogue, and it gave me a lot of autonomy early. And so it's made this process, I don't know, just a little bit more enjoyable.
That's really helpful. It also, I think, speaks about like a pet peeve I have about my own parenting and parenting. I see where, we want our experience to give us like wisdom and skills, and especially like, that key knowledge maybe our kids might need. And if it doesn't really work, I was talking to a relative about their use of narrative stories, and they were saying, if I've been in a similar situation, I say, I'm not sure what you should do. I was in a similar situation once. Maybe this helps. And they just share how they messed it up. I totally messed this up. I don't know what I was thinking. And they just, that's it. There's no advice other than here's a story of how when I was your age and I did that, I really messed it up.
Yeah.
And it's just a shift from that kind of way I think often we feel as parents, like, well, let me tell you about the experience and knowledge, wisdom, and almost not even consciously, but just kind of like we have some expectation, or men often have an expectation to kind of be a certain way, strong, resilient, not needy. Feels like as parents, there's a similar bias of knowledgeable. So, how did your folks get so good at that? Like being more curious? Were there like phrases they had, or did they like sit down around the dinner table at night and say it's time to share more, or was it just
Yes.
like what were their cues?
So my dad was the best human being that's ever lived. That's just objective facts. That is who he is. And the way that he addressed us is that he's like, I want to talk, when we talk, I want to talk about ideas. I don't want to talk about people. I don't want to gossip about things. I don't want to talk about things that happened today. I want to talk about big ideas, and tell me about what you think about this. And so there was just a lot of talking. We talked and talked and talked and talked. And and so when I had my first child, he's like, whenever try to just answer or encourage conversation. Don't just give them a plain yes or no. Ask questions, involve them in a dialogue, because you're just going to expand both of your worlds so much.
So it's so wonderful to be talking about your dad, Sasha. I don't know you well, but I think he passed away somewhat recently.
Yeah, in April, end of April. And so I will talk about him ad nauseum. You got another hour to do it? I'll do it.
I mean, sharing the wisdom of your dad is a real treat. It's a real honor to be part of that, and just to hear a bit about him, and for that value that he cherished about parenting, and in some ways about human relationships. Let's talk about the big ideas. Let's talk about the big stuff. The kind of the top of the license of our human mind, where we're not into the whatever pettiness about other people or about this or that, but really in these higher ideals of how we are with each other, what we can create, what we can accomplish together through connectedness and compassion and mental fitness. That's got to be a big, a whole nother subject around grief, loss, and where you are. And we're at the end of our time. So I'd love to have you back on.
I'll be
I'm
back.
wondering, besides your pop, whether there are mental health or mental fitness kind of heroes that you have, or people that you look to. You've mentioned some folks in residency, and you've mentioned your dad for sure. But are there people that are great resources to folks, especially in the world of ADHD?
Well, I got to tell you, I've learned so much from you. I mean, and this isn't just like about the kombucha that you gave me, which has been awesome, but just in nutritional psychiatry. I mean, I think that it's so important that people are talking about that, because this is one of those things that it impacts everything. You feel better, you sleep better, you think better, and so I would put you in that category.
Thanks.
You're on there.
It's really nice thing to say. Also, ADHD nutrition is really one of those spots that I think is fascinating because it all gets like food dyes, food dyes, food dyes, sugar.
I know. Yeah.
And it's like, okay, the food dye data is kind of nuanced and interesting. I think the most recent paper I said theorized that about 9% of global ADHD could be attributed to things like food dyes. That said, your nutrition advice for ADHD isn't just like no food dyes, guy. I'm curious what when you sit with somebody, some kind of basic moves. I'm like, oh, I'm overwhelmed with nutrition and I have ADHD. Are there some basic things? Like one tip you had I loved is put the food out. Don't have it hide under the cover. You have ADHD. I want the protein bar on your desk. I want the protein shake. That's a great tip. Are there other ways that you get involved with nutrition with patients that have ADHD?
I think viewing it non-judgmentally. I think it's so easy to look at food as good or bad, but food is something. Food is something to fuel your body, right? And so you have to find out what's the right kind of fuel for your car. And so there's going to be times where because of lack of resources or lack of time you're making decisions where you're just like, oh, okay. And it's like a quick fix. Doesn't matter. You're still putting fuel inside your car. Is it the best kind of fuel? No, but it's going to keep your car going. So I just be non-judgmental and like look at it and try from a curious perspective. What do I feel best after eating? And then try to put more of that in your diet.
I love that advice. And I also like that you're kind of focusing, especially for patients with ADHD, around the kind of structure, framework, and organization of food. Right? Quality is important, but what's most important is actually eating consistently. And so if it's a little bit of fast food, okay, maybe you're not going to feel your best. Pay attention to that, but it's better than nothing at all. I love that advice. Everybody, there we did it. It's another session, an hour focused on mental health, mental fitness. We've gotten to talk today all about ADHD, about focus. We've gone everywhere from talking about stimulant medications and the appropriate use of them to different ways to stay curious around our own mental health, but also just inspiring us. Make sure and follow her on TikTok and Instagram. I follow Sasha. I find her really fun and inspiring. And what I like about you is I always feel like I have a buddy in the mental health journey. I don't know why that is. I just feel like I've got this, like, you're like some fun, like, I don't know, I kind of see you as like a zany college, like dorm classmate. and you're up studying and you're fun, but you're also serious. And so I just really appreciate that. If you're struggling with ADHD, folks, please give Dr. Hamdani a follow. I hope she can be helpful to you in your journey. There's been another episode of the Dr. Drew Ramsey podcast. We're here to talk mental health, mental fitness. And as with every episode, I have the same request of you. And it's not to share, like, subscribe, etc. Sure, that would be great. But mostly I want you to take something from this conversation and do something with it for your mental fitness in the next couple of days. That's my request. That's the cost of admission. We're here to optimize our mental fitness and our mental health and show it can be done. And it can be done through conversations like this. Everybody, I will see you next time. It's an absolute treat to get just a little bit of your time in this very busy world. Dr. Hamdani, please give her a follow. Sasha, I'll see you soon. Thanks so much.